Start of another work week, or not. Everybody knows from my right, Dr. Jim Malatras, not a medical doctor, but still a doctor. Dr. Howard Zucker, to my left, Melissa DeRosa, Secretary to the Governor. To her left, Robert Mejica, Budget Director Extraordinaire. On the numbers, the number continues to increase to 8,658 new cases. Overall, we have 130,000 people who tested positive, 16,000 people in our hospital system, 13,000 people have been discharged. Number of deaths are up. Once again, people we lost. Number of New Yorkers, 4,758, which is up from 159, but which is effectively flat for 2 days. While none of this is good news, the possible flattening of the curve is better than the increases that we have seen. New York is still far and away the most impacted state. New Jersey is having real difficulty. I've been speaking with Governor Murphy from New Jersey, and anything we can do together, we will. Michigan also. California has leveled off, and Louisiana is having a difficult time, so they're in our thoughts and prayers. Total number of hospitalizations are down. The ICU admissions are down, and the daily intubations are down. Those are all good signs, and again, would suggest a possible flattening of the curve. The number of discharged is down, but that reflects the overall reduction in the numbers. Big question that we're looking at now is what is the curve? About cases increase until they don't. When they stop increasing, then what happens? And the projected number of alternatives, some suggest basically the curve goes up and then drops precipitously. Straight down precipitous drop, which is the peak effect. No one can tell you will occur. They say any one of the three options. You study other countries, you've had a combination of the above. Studying it as we have used the projection models from day one to determine actually what we do. How do we set policy and following the data? Dr. Malatras has been working on the numbers, working with the statisticians and the projection models, and helping us incorporate that into an operational model. And Jim, if you want to just take a moment and speak about the projection models here, please.
Great. As the governor said, we have been looking at projection models from the beginning to determine the size and scope and severity, and the governor has mentioned this over his briefings. We've been working with many organizations and using their data like Imperial College, the Institute for Health Metrics and Evaluation, and others. And some of the initial projections that we first saw at the beginning of this was at least 100, up to 110,000 beds for COVID patients alone. And the peak would come at the end of April. The earliest modeling from many organizations that it would be at the end of April, around 110,000 beds just for COVID patients. Two that we were tracking, one being lower at about 55,000 COVID beds, but again, peaking at the end of April. We follow now that we have a pretty robust data set to go by for the last several weeks. The bottom line there, the purple line, is sort of where we are tracking today, which suggests it's a little lower. And the question was, what could you do to lower those initial projections from 110,000 and from 55,000? So a lot of the activity was, we saw where the statisticians and the at these types of models said it was going. So what activities and actions could you take to aggressively lower that overall number? And what the governor has been doing was aggressively enforce and enact social distancing to lower the overall number. And this number and the current data suggest exactly what's happening. And it's not settled yet because we are going day by day, and the numbers, as the governor says, has changed a lot. over the time based on what numbers come in, but this could suggest that we are indeed potentially at the apex or beginning to be at the apex at this moment. Like the governor has said, there's been a range of models, 7 days, 14 days, 21 days, 30 days. It looks like we're towards the earlier side of that time frame based on the current projections and modeling that we've been looking at.
Thank you. On these, you see on this slide where we are now, right? And it can still go, we could still see an increase. So it is hopeful, but it's also inconclusive, and it still depends on what we do, right? These models all have a coefficient of what we do, we are social distancing, et cetera. And from our decision-making point of view, it doesn't really matter if we've hit the plateau or not to do the same thing. If we are plateauing at a very high level, and there's tremendous stress on the healthcare system. To say to this healthcare system, which is at maximum capacity equipment, who has gowns, who has masks, and that happens on a daily basis, that adjustment. Also to relieve pressure on the hospital system. The Javits coming on is a very big deal. That is the relief valve for the entire downstate system. The 1,100 military personnel come in. 300 were sent to New York City public hospitals to help the New York City public hospital system, the H&H system, which is the rest will be going to Javits to bring that up and running to full capacity. That transition is happening now. That is a center now, started as non-COVID. It's now a COVID center. The majority of the military personnel will be coming in tomorrow and the next day. But that Javits Center is going to be a major relief valve. That would come in for non-COVID people. The original plan was it would also be a relief valve on the hospitals, but not for COVID people, that it would take all the non-COVID patients, if you will, from the hospital system. That was the plan. As it turned out, there's not a lot of COVID people in the hospital system, which is a separate story, happens to be a good news story. A byproduct of shutdown is you have fewer car accidents, crime rate is way down, fewer trauma cases fixed. Why? That's Mother Nature. That's a question that God can only answer. But control what you can, do what you can. The challenge is to make sure that we don't lose anyone who could have been saved if our healthcare system was operating fully. Lose anyone who you could save. That is a legitimate, ambitious government. And that we have done so far. Have we saved everyone? No. But have we lost anyone because we didn't have a bed, or we didn't have a ventilator, or we didn't have healthcare staff? No. The lost are the people we couldn't save. Not for lack of trying, and not for lack of doing everything that we could do as a city, not only as a government and as a healthcare system. So to the extent we can find peace in that, it helps me. We are still New York tough, and New York tough means tough, but tough in a New York sense also means compassionate. We are unified. It means that we are loving, because if you're really tough, the really tough guys, they're to show love, and because we're smart, and that's how we're going to get through this. Questions?
State's drug trial of hydroxychloroquine and chlorine going?
We've allowed usage of the hydroxychloroquine with the zithromycin pack in hospitals at their discretion. The federal government is going to increase the supply to New York pharmacies. We had a 14-day limit you could buy because so many people were trying to buy it. If the federal government increases the supply to New York, which they say they're going to do, lift the 14-day limit. There are a lot of people who rely on this, who were relying on it, people with lupus, et cetera. In the hospital, they won't say that they're too short a period of time to get a scientific report. Administrators, doctors want to give official data yet from a hospital or a quote-unquote study, which will take weeks, if not months, before you get an official. Is that a fair statement?
So promising, but not conclusive, it sounds like,
On which?
on that type of treatment in hospitals.
Yeah, anecdotal evidence that it is promising. That's why we're going ahead. Doctors have to prescribe it. There are some people who have conditions where it doesn't work, or they're taking medication that's not consistent with this treatment. But anecdotally, it's been positive. We'll have a full test once they have a large enough sample and data set, Jesse. But anecdotally, it's been positive. And additional supply which the federal government says they're going to send. I'm going to mention it to the president, actually, when I call him this afternoon with the, I'm going to make a note right now. If they increase the supply, we can lift the 14-day limit ban.
Earlier today, there was the note that the city would maybe be burying these COVID bodies in parks in New York City. Wondering, one, have you heard of that? And two, is there any way?
Have they asked for any more at this point?
They have not asked for any that they have not gotten. We're releasing 802. The city is basically responsible for the 11 health and corporation hospitals, public hospitals. There are 11 health and hospital corporations. 11 health and hospitals in that system. And I spoke to the head of the system last night. I'm going to speak to, he's going to be on at 1 o'clock, Dr. Mitch Katz. He had all the equipment he needed, and we told him again at 1 o'clock. So if they need anything, we'll get it to them.
Is the 802 combined? Like, that's how many?
802 for the downstate area. Now, every hospital will say to you, I am running low on everything, because they are low on everything. Right, when these daily surge and flex discussions, there's no margin for error because we don't have any margin for error. Don't have the supplies. The whole system is over capacity. So everybody is low on everything. And if they had a wish list, stockpile and a reserve in their own hospital. I get that. We don't have that luxury. Ventilators from one hospital on a daily basis, bringing them to another, and then shifting them back and forth so every hospital can get through this period. It's sustainable for us. So we're doing that with PPE equipment, we're doing that with ventilators, we're doing that with patients. If we can get patients out of the hospital system into Javits and the comfort, then you can relieve pressure on the whole system. System is running at red line, has been for days. This is the most intense management function that we have ever undertaken. So it's not here, in this situation, it's not what they want, it's what they need. That's what I say. Everybody would want, I want to have 100 ventilators on reserve. I know. It's what you need. And that we're doing on a day-to-day. Everyone has what they need. There is no one who said, I'm out of ventilators and I have a critical need who hasn't gotten them.
You're calling for.
Go ahead.
You're calling for increases in crackdowns on social distancing, but we're getting reports of funerals and weddings in Orthodox Jewish communities in Rockland County and in Brooklyn still being attended by hundreds of people.
Then they should enforce the rule, Jesse. I don't care if you're Orthodox.
Forces to try to break these
The
sorts
state police will enforce it also, but let a local government, it's a job of local government to enforce. I'm doubling the fine. It's my way of saying, this is serious. This is serious. What right do you to act irresponsibly in a way that could get you sick or someone else sick, and then I have to send an ambulance to pick you up and bring you to an emergency that's already overburdened, that doesn't have staff, doesn't have supplies, doesn't have ventilators, because you were reckless and irresponsible. You don't right. And I have to talk to these healthcare workers all day long. I talk to transit workers. I talk to first responders who, truthfully, nobody wants to put themselves for the year, and I don't think we're in that position. We've extended the use of absentee ballots.
Governor, are portions of
Slowing, plateauing, turning, but also dependent upon what we do and how we handle ourselves. And we know that social distancing is important. That's why I'm extending the ban on keeping businesses closed, extending the ban on schools. But people, it's individual behavior that has been problematic over the weekend. I get that it was a nice day and the weather was good. Social distancing, you will see those numbers go up again. That's why I showed you the Hong Kong, the China experience. They let their foot off the gas too quickly. And we have been behind on this virus from day one. The virus has kicked our rear end. And we are moving ventilators now among the system. When someone has a chain load and they have additional ventilators, we move ventilators. But we have moved thousands and thousands of ventilators throughout the system. We've acquired thousands and thousands of ventilators. I also want to thank Oregon for ventilators. I want to thank the state of Washington for releasing ventilators and suggest that they be sent here. I want to thank California this morning, released ventilators because they thought that they could be helpful to New York. That is the right attitude. That's the only way we do this as a nation. We're going to have to be flexible and handle the surge as it moves across the country. That's just what we're doing here in this state. Surges in Nassau one night, we move assets to Nassau. Surges in Rockland, we move assets to Rockland. So that's the only way we're going to do it, because the federal stockpile. If the federal stockpile has 9,000 ventilators, that's not going to do, it's not going to be enough for a nation, right? So you're going to have to get states cooperating and shifting and moving within the country. New York will be first on that list. As soon as we get through this and we have any flexibility in our system, we will be there for every other state, like they have been there for us. And we will lead, we always have. Hurricane Katrina, we were the first ones down there, right? So when anyone needs anything, we're there. Right now, healthcare-wide, I'm going to get on the phone with the hospitals now. There's no hospital that needs ventilators that doesn't have ventilators. There's no hospital that needs PPE that doesn't have in the state system. Again, they're all going to say they're running low because they are, but nobody doesn't have what they need to do. And that's my point on perspective. Are we managing this situation the best it can be managed? Yes. Have we lost anyone who we could have saved? I don't believe so. And with that, we can sleep at night. I have to go to work. Thank you, guys. We don't need any ventilators right now, and we have, California has released ventilators, state of Washington has released ventilators. We got 1,000 ventilators from China, so right now we're okay.
Moving forward on that plan.
I will just have to confirm it as a spot for temporary burials.
I'll see you tomorrow.